Good morning, evening, whatever the case may be. Welcome to our presentation in which we will be discussing the impacts of ambulance-based imaging of stroke patients, including their strengths and their weaknesses, as well as their future prospects. Medical imaging first began in 1895 with Wilhelm Röntgen's discovery of X-rays. Röntgen discovered these waves when he propelled high-energy electrons towards an anode. These electrons interacted with the atoms in the anode, releasing an unknown type of radiation, which he coined X. Today, X-rays play a vital role in medical imaging and are the same type of electromagnetic wave used in a number of imaging modalities such as real-time fluoroscopy, digital radiography, and X-ray computed tomography. In correlation to ambulance-based imaging, computed tomography, abbreviated as CT, is the most prevalent imaging modality due to its fast operation and precise data feedback. CT scanning works through processing multiple images taken at different angles to form a layered representation of the subject. This is performed within a gantry through the use of a rotating ring that carries both the X-ray source as well as the detectors. The ring circulates around the gantry whilst taking numerous images of the subject in its center. These images are then computed and mapped into a 3D image of the subject through the use of a complex algorithm. This allows for the identification of any abnormalities that may exist within the body and to assist in the diagnosis and treatment of a patient. The CT scanners currently being tested and used in ambulances are much smaller, having the necessity of being compact and portable. MRI scanners, on the other hand, may also be used, however their size is often much larger and requires additional space within the ambulance to operate. In medical emergencies such as strokes, where urgent treatment is required, CTs allow for the precise location to be identified so that emergency staff can provide the proper pre-hospital treatment. This is of utmost significance due to how crucial time is when a stroke occurs, as every second matters. What is a stroke? Well, a stroke occurs when blood flow to an area of the brain is disrupted. When this happens, brain cells are deprived of oxygen and begin to die. When brain cells die during a stroke, abilities controlled by that area of the brain, such as memory and muscle control, may be impaired or permanently lost. There are two distinct kinds of stroke, ischemic and hemorrhagic. Both strokes result in the death of brain tissue as they restrict the flow of oxygenated blood to the brain. Ischemic strokes are the most common of the two strokes and involve a blockage of an artery to the brain. This is most often due to the formation of a blood clot. These clots are caused by fatty acid deposits in the arteries restricting the flow of blood, which build up over time. Hemorrhagic strokes are much more severe. These occur when a blood vessel bursts and bleed into the surrounding cranial area, leading to tissue damage. These are usually caused by high blood pressure and the use of blood thinners. Doctors advise that to reduce the chance of a stroke occurring, it is best to manage your cholesterol levels, maintain healthy blood pressure, to stop smoking, and lead an active lifestyle. Both ischemic and hemorrhagic strokes require different treatments in order to minimize the potential damage caused by hypoxia. Ischemic strokes are treated using tissue plasminogen activators, which work by dissolving the clot and improving blood flow with blood thinners. Whereas the opposite treatment is performed in the case of a hemorrhagic stroke, in which drugs that reduce blood flow are implemented instead. The use of medical imaging in ambulances to identify and treat strokes has been shown to be very effective for a number of reasons. The most apparent benefit that ambulance-based imaging accounts for is that the otherwise unused time spent transferring the patient to a hospital via an ambulance can be used more effectively by taking a scan of them whilst they are being transported. This subsequently allows for staff both within the ambulance and at the hospital to obtain useful information regarding the cause of the stroke and location of the problem long before they would have without the technology. This thereby allows the staff to better prepare both themselves and the arriving patient, while staff back at the hospital can diagnose the patient under less pressure. The paramedic imaging team can work to calm and treat the patient with precursory medication for the determined stroke type. As forementioned, time is an incredibly important variable in regards to treating strokes. Every minute a vessel damaged by an ischemic stroke is untreated, the average patient loses 1.9 million neurons, 13.8 billion synapses, and 12 kilometers of axonal fibers. Every hour without treatment, as many neurons are lost as an adult brain would lose in 3.6 years of aging. By determining the type of stroke and its location from within the ambulance, the time it takes to begin treatment is drastically reduced to a point that an exponential amount of brain function can be saved. An exemplification of this is the ambulance stroke unit in Berlin, which reduced arrival to treatment time by an average of 36 minutes and increased the utilization of IV in ischemic stroke patients by 50%. However, there are also several limitations surrounding the use of imaging scanners in ambulances. Firstly, the production and installation cost of imaging devices in ambulances is very expensive. The cost ranges from somewhere between $60,000 to $300,000 per ambulance, excluding the maintenance cost. Thereby, widespread application of these devices would be very costly to the health industry if ambulances specialized in strokes were put into mandatory legislation. Ensuring that safe and useful images are obtained requires existing ambulance personnel to be trained, or requires radiographers to be on hand in order to ensure the patient is imaged by a verified professional. These training programs can take a number of years due to the skill set required to operate medical imaging equipment efficiently and safely. Improper use could lead to overexposure of radiation to the operators or even the patient. Because of the distinct difference in the treatment of each type of stroke, incorrectly diagnosing the patient due to the higher stress situation within the ambulance may result in catastrophic effects due to the opposing effect that the treatments induce. Even preparing the patient for imaging within the ambulance can pose a risk to the stroke victim. CT scanning requires the patient to remain relatively motionless so that images can be taken properly. A person suffering from a stroke would experience weakness and/or numbness to parts of their face or ligaments. They may also have difficulty speaking and communicating with the paramedics. On top of this, they may be experiencing dizziness and nausea, lose their vision, or even experience hallucinations. For a patient who is having a stroke, positioning them or restraining them for an imaging scan can put further strain upon their body and even injure them. There is also the potential danger of muscle spasms or a seizure occurring, which is commonplace for those suffering from a stroke. This can thereby put the patient and even the paramedics in danger due to the enclosed space of an ambulance equipped with an imaging device. The use of CTs in ambulance-based imaging has many limitations. However, in our opinion, the potential benefits definitely outweigh these cons. In the event of a stroke, urgent action is required by the emergency staff to ensure minimal damage to the brain from hypoxia. Using medical imaging devices such as CT scans or MRI, it is possible for the emergency staff to locate the position of the implication and apply precursory medical treatment in order to reduce the damage the stroke may cause. Some future prospects for this technology would be more efficient ambulance-based CT imaging equipment, which would allow for the scans to take place faster. Generally, a CT scan takes approximately 5 minutes to perform. However, in the event of a stroke, every second is variable, so reducing this time is absolutely vital. Another potential benefit that could arise is for the technology to branch out into mobile imaging services for usage outside of the emergency assistance. All in all, ambulance-based imaging for patients undergoing a stroke has shown outstanding positive results, and are already being implemented in a number of countries including Australia, Germany, and the US. Over the next few years, it is very likely that this technology will become even more prevalent and will lead the way to further advancements in the treatments of strokes. And this here is just a short video to help recap what we've already discussed. We hope that you found this presentation interesting as well as informative. Thank you for watching.